Let's talk about sex, baby. Okay, now that I got your attention, this actually is a very important topic and usually overlooked by most oncologists. 60 to 70% of cancer patients report sexual dysfunction, and some say this is the most underserved and unmet need in oncology today. So if you or someone you know has cancer, it is quite likely this is or can become a side effect, that is sexual dysfunction, which will decrease their or your quality of life. And as we know, decreasing quality of life leads to poor outcomes in cancer. So share this video and stick around because you will basically be bombarded with potential treatment aims and solutions. So stick around to help mitigate any negative changes in your sex life if you or a sexual partner of yours has cancer. By the way, hi, I am Dr. Lisa Mateka, naturopathic physician, energy worker, and transformational life coach that helps people with cancer navigate their journey back to health and wellness to an even better state than before on all levels, physically, mentally, emotionally, energetically, and maybe even spiritually. So the sexual dysfunction side effect of cancer, well, it can be, usually it's a side effect of the treatment, but it can be a side effect of the cancer itself. It is defined as any problem that can occur at any or all phases of the sexual response cycle. So that could be libido, arousal, climax, or resolution, a problem with any of those phases of the sexual response cycle. And so why does this occur? And by the way, it occurs over 90% of sexual dysfunction in cancer occurs in GI or GU cancers. So GI cancers like colorectal and others, and GU, genital urinary cancers such as bladder, ovarian, uterine, prostate. So that's the most common. And any kind of radiation to the pelvic area can lead to this. Also, it's a side effect of many chemo drugs, endocrine therapy drugs, surgery. And when it comes to surgery, it could be the trauma itself in that area, if it's in that area, or it could be because of removal of organs, that had a role to play in the sexual response cycle. There's also hormone imbalances that can occur with hormone deprivation therapy. Also things like IBS or colitis, which commonly occur secondary to other conventional cancer treatments, also can occur due to candida or other infections, which are secondary to other cancer treatments. You know how they lower the immune system. Pain syndromes, which are common in cancer. Hypoxia, which is like not getting enough oxygen, which is common in lung or other cancers. It can result in sexual dysfunction. And then, of course, there's just the mental emotional component from the diagnosis itself. Talk to your oncologist about this. Have an open, honest, vulnerable conversation. A lot of times they won't bring it up because they don't think it's that important relative to other things, or they're just very uncomfortable bringing it up and don't want to bring it up on their own, might think that's weird or something. They're uncomfortable. But if you bring it up, then it will be treated as, in a respectful manner, as a serious thing. So give it a whirl. You may not get the response you prefer, but you might, and it could lead to other helpful referrals that could really help you. So don't be afraid to do that. And of course, if you're more into natural stuff, and I highly recommend you should do this anyway, regardless of what your side effects are. If you have cancer, I highly recommend seeking out some sort of natural help, a naturopathic doctor, a holistic professional of some sort. And especially since I'm going to be talking about things that can or may modulate hormones, it really is better if you just don't do this on your own. And if you have some kind of holistic professional, naturopathic doctor, herbalist, etc., helping you, that is going to be something I recommend anyway. I mean, this is just a short video. It can give you some information, some education, perhaps some inspiration, and it can actually, I'm going to mention a lot of things that you could potentially do. And some of these you could, In theory, you could just pick up at the store and do on your own. Although, like I said, it's better if you really have it okayed by a professional. And then some of this stuff you can't do on your own. You would have to go to a professional to get the treatments done, whether it's like a laser therapy or something like that, pelvic floor therapy. So that's just my little disclaimer there. But I'm going to get into some things that are helpful for females and then males. So, because they are different. And then some things that are helpful for both. So let's dive right in. Okay, we'll start with the ladies. So, of course, what you would do depends on what the exact problem is. I'm just going to be speaking generally right now for vulvovaginal changes which can occur. So, I'm going to start with things like vaginal moisturizers can be very helpful because a lot of times the problem is a drying out or tissue integrity becoming friable, things of that nature. So vaginal moisturizers are different than lubes, by the way. Lubricants are for sex. Vaginal moisturizers, you just do that on your own daily or a couple times a day. And what you want to look for in vaginal moisturizers are ones that are made with hyaluronic acid or polycarbonyl, or if you're going for natural ones, aloe, flax, olive oil have been shown in studies to be good. And everything I'm saying is verified in studies, by the way. And then when it comes to lubes for sex, yes, you want to use them, first of all. And here's what you don't want to use and what you do want to use. So stay away from things that have scents, flavor, sensation enhancers. Stay away from things that have glycerin or petroleum based. This disturbs the flora, among other things. You want things that mimic the osmolarity and pH of the actual vagina. You want fragrance-free, dye-free, water-based. Water-based is best in this situation. And the thing with if you have high osmolarity, it actually can damage tissue and lead you to be more susceptible to infections, things like bacterial vaginosis, herpes. In fact, there's studies KY jelly and Astroglide actually increase a woman's chances of BV, bacterial vaginosis, by 33%. So you do want to be careful with that. Of course, there's hormone replacement therapy or just like hormone therapy, which is way beyond the scope of this video. But what has been shown to be helpful in this situation are things like low dose topical estriol or a oral estradiol. So then there's exercises that can be done to preserve vulvovaginal integrity. So it's recommended regular penetration to tolerance, basically to preserve tissue elasticity and to prevent adhesions. So this doesn't mean you have to have sex all the time with somebody. You can use, there's tools for this, dilators, dildos, your own type of massage with your fingers. This goes for vaginal as well as anal. Pelvic floor therapy. This is somebody you would be referred to, or there is an online series that's pretty good. So that's like internal exercises you do, kind of like Kegels, but it's way more than that, more complex than that. But pelvic floor therapy can be helpful. And there's also these like soft stretchy bands you can insert in vaginally to sort of limit the depth of penetration, and it helps the tissue when it's in a fragile state, protected and whatnot. There are laser treatments. So when it gets a little worse, if it's a little bit more where there's starting to be vulvovaginal atrophy, there's things like microablative fractional CO2 laser therapy or the erbium YAG laser. So these are things that are options as well. The point here is to show you that there's a lot of options, and you can ask your doctor about some of these or find someone who does them, or, do some of this stuff on your own. So I'm going to talk a little bit about the microbiome. So the next things I'm going to say are specifically good for the vaginal microbiome, which we know is important because when it's not in balance, there's all kinds of susceptibility to infections as well as pain with sex. So here's some things to know to do for the microbiome. So here's what to avoid: douching, perfumed soaps, detergents, fabric softeners, even certain toilet papers. You gotta you got to see what's all in your toilet paper. Sometimes there's like bleaches and stuff that can be irritable. Avoiding petroleum products, avoiding things of that nature. Rubber products is what I was searching for in my head. So petroleum products, rubber products, you want to try to avoid. And synthetic garments, especially when it comes to the panties. So I know they're not necessarily usually the most sexy, but in a susceptible state like this, it's like cotton is basically one of the best, and not like the synthetic panties. So other things for the microbiome, of course, what we eat matters. So eating fermented foods is great. Eating anti-inflammatory foods is great, which you should be doing anyway if you have cancer. Eating foods with phytoestrogens. I'll get into more of the food stuff later. Probiotics. So lactobacillus and lactis crispatus are good if you are suffering from low libido or vaginal dryness. But probiotics, again, those are kind of hit or miss. It really depends on your flora, but those are typically good ones. And it can be good to do certain suppositories if you have an issue, or sitz baths. If you don't know what a sitz bath is, it's basically making a giant tea that you dunk your pelvis in, so you're soaking your genitals in. That can be really nice. Now we get into some supplements that are good for vulvovaginal changes. I'm going to name some oral as well as topical. So some oral supplements that can be helpful specifically to promote tissue integrity and modulate inflammation. We have omega-3s, B vitamins, vitamin D, and collagen. Oh, and magnesium. And DHEA is a really powerful one as well, DHEA, and medicinally formulated hormone balancing teas. So these are basically like herbal teas, best if you get them formulated specifically for you, but hormone balancing herbal teas. Then we have Tribulus, vitamin E, oral or topical. So getting into topicals now. Fennel cream, pomegranate seed oil, and a really cool one with a lot of studies that have been coming, or some good, I can't say a lot, but some good studies that have been coming out, is Pueraria mirifica vaginal gel. Pueraria mirifica. I don't think there's a common name, at least not that I'm aware of. It's a herb native to Thailand that has estrogenic properties, and it's related to legumes, I believe. So there's those for you, but there's more. Okay, let's talk a little bit about essential oils. So I had mentioned suppositories before. It's good to get cocoa butter suppositories, and you can get these at compounded pharmacies and have them add lavender, chamomile. Those are good herbs for vulvovaginal changes. Some essential oils that are good, and you can use these in various ways. Some essential oils that are good for increasing oxytocin, which can be very helpful for you if you have hormonal side effects, if you have any atrophy going on, or genitourinary syndrome of menopause, which happens a lot of times with cancer. Then some essential oils that could be good for you are Roman chamomile, lavender, clary sage, Indian sandalwood, jasmine, and neroli. And there was also a study with neroli, the exact species I'll have listed here. A neroli essential oil that was either 0.1% or 0.5% neroli essential oil was inhaled for 5 minutes twice a day for 5 days. That's it. And there was improvements in genitourinary syndrome of menopause, and as well as blood pressure too. So essential oils can be very, very powerful. One that's good for libido, to increase libido, because that can decrease with cancer, is ylang ylang. Ylang ylang, lang lang. I was never quite sure how to say that one. And so now I'll get into some of those herbs. So you could have an herbalist or a naturopath or a holistic person that's familiar with herbs come up with a formula that would be good for you specifically with any of the following herbs. There's probably more, but this is a pretty good list of potential hormone balancing herbs that help in this situation. We have things like hibiscus, ginkgo biloba, rooibos, ginger, ulmus, which is elm, ulmus fulva or ulmus rubra, slippery elm, Actea racemosa, black cohosh, chase tree berry, Vitex agnus castus, Trifolium pretense, red clover, ashwagandha, Withania somnifera, Matricaria chamomilla, chamomile, Zea maize, which is a type of corn, Althea officinalis, which is actual marshmallow, calendula, and raspberry. Okay, time for the males. That was the anatomical females. Now for anatomical males. My boys. Okay, so these are some of the things that may be recommended to you. Some are better than others, and find what's right for you. When it comes to sexual dysfunction with males who have cancer, we're generally talking about erectile dysfunction. So the stuff I'm mentioning is more specific for erectile dysfunction, but there could be all kinds of other things too, like low libido. So some of the stuff may not apply to that. So speak with your health professional. So some things that may be recommended, like I said, some are better than others, of course, are drugs. There's actual penile injections. There's intraurethral suppositories. There's penile prosthesis, which is like an implant, but specifically for erectile dysfunction. Yeah, there's all kinds of stuff out there. Of course, lifestyle stuff. This is probably what I would start with. Well, I mean, this is more of a long game, but things like losing weight, preventing diabetes type 2 and cardiovascular disease, quit smoking, that's going to be really helpful. We have, of course, sex therapy, which is nothing to be ashamed of. Couples do this. It can be it can be quite great for your sex life. So specifically with the sex therapy, this has been studied specifically for this cancer population. Sex therapy with a sensate focus and meditation and mindfulness exercises where both partners are involved can be very helpful. We have things like vacuums and cock rings, pelvic floor therapy, massage, that's anal, perianal, just I guess all different types of massages, which you can do yourself. Oh, prostate, that's another one. Prostate massage, perianal, rectal massage. Things that can enhance sex, whether it's different positions, whether it's sensory deprivation or sensory enhancing things, role playing. I mean, this is what is said. Porn was actually mentioned. I've never personally prescribed that, but that was something mentioned. Vibrators can be a good one because the nerve pathways are easily stimulated and that can lead to an erection. Then some next level therapies, if something more intensive is needed, there's restorative and regenerative therapies such as stem cell therapy, hyperbaric oxygen, platelet-rich plasma injections, LIST low intensity shock therapy, and all of these things over several weeks can lead to angiogenesis and neovascularization, so basically the creation and formation of new blood vessels, and this can actually turn people who don't respond from Viagra into people who don't respond to Viagra into people who do respond to Viagra. So yeah, that can be very helpful therapies as well. Now we get into supplements for male sexual dysfunction. So a combination of these can be very helpful. We have epimedium, which is horny goatweed, yohimbe, rhodiola, ginseng, ashwagandha, fenugreek, pomegranate, but not if you're on ADT. If you're on ADT, no pomegranate. DHEA, arginine, of course, anything that's going to increase nitric oxide can help. L-citrulline or just citrulline. B vitamins, vitamin D, CoQ10, magnesium, zinc, resveratrol. And then besides the herbs I already mentioned, other botanical tinctures or formulations that can be useful are damiana, hawthorn, hibiscus, oats, ginger, and donkai, Angelica sinensis. That's what I call it, Angelica sinensis. And now I'm going to get into some things that are relevant for regardless whether you identify as male or female. These are some things that can help in general. First of all, as far as low libido goes, just be aware if you're on medicines like SSRIs, SNRI, tricyclic antidepressants, because those are gonna decrease your libido also. And I'm not saying don't take those. That's definitely something you have to discuss with your provider, but just to be aware of that. And as far as foods go, it is a good idea to avoid trans fats, hydrogenated oils, and processed foods as much as possible. And here's what you do want to eat. It's good to include as much as you can pickled foods, cruciferous vegetables, so that's like your broccoli, cauliflower, Brussels sprouts, etc. Phytoestrogen food, yes, regardless whether you're a male or a female, yes, phytoestrogens, it will do what it needs to do in your body. And that includes foods like edamame, soy milk, tofu, tempeh, oats, flaxseed, sesame seed, alfalfa, broccoli, mung bean, sprouts. And then lignin-rich foods. Lignin-rich foods are a great idea. And that's things like berries, apricot, beans, tofu, certain seeds, certain cruciferous vegetables. That's something you can look up to get a more complete idea. Also whole grain and bran like rye, wheat, and I believe oat. And isoflavones, you want to get those in as well. Isoflavones, that is found also in some soy products such as miso, natto, tofu, tempeh, certain beans, lentils, peas, and quinoa is a big one too. Quinoa with the isoflavones. And anti-inflammatory foods. I mentioned this before. There's a lot of those. You can look that up for yourself. Anti-inflammatory foods are typically greens and veggies, but there's a list of them. Fragrant spices are a great idea to add in. Fragrant spices, omega-3s, MUFAs and PUFAs, monounsaturated fatty acids and polyunsaturated fatty acids, such as found in nuts and fish, respectively. And regardless whether you're male or female, you can benefit from the CO2 laser or erbium YAG or various radio frequency devices that can help. So that's all I'm going to give you for now. I told you might be bombarded with some treatment aims and solutions. So hopefully you weren't overwhelmed, but maybe took a list, jotted some things down that you can easily incorporate today, like the diet, like the lifestyle stuff, maybe some supplements. And if you have a bigger problem, do talk to your, I think regardless you should, do talk to your oncologist. Definitely get a naturopathic practitioner or some kind of holistic professional to help with if it involves hormone balancing. That's something that requires professional guidance. Take some of these, bring it to them, see what they say, get a good combo of what would be good for you. They'll know what all the things I mentioned, what would be the best for you. And yeah, so there you go. It is very common. Don't feel alone. If you have any sort of sexual dysfunction and you have cancer, it's way more common than you might realize. Like I said, 70% of cancer patients have this. So 60 to 70%. So you're not alone. It's not necessarily going to last forever, but there are things you can do now to protect the tissue integrity and things so it doesn't have any sort of lasting effects. So it is good to be proactive. And yeah, I hope you found this helpful. Share it if you know someone that has cancer. And thank you all. And until next time, much love.